Assalamualaikum and a very good morning. A warm welcome to all participants from Malaysia, the SEAMEO network and affiliated countries to IMR-SEAMEO webinar series 2022. The theme today is laboratory animals, rodents. This topic will be further explained by our speakers today as an informative sharing to all participants, as we know that these laboratory animals are commonly used in research purpose as well as teaching materials. I am Dr. Azlina Zulkapli, a veterinary officer from Laboratory Animal Resource Unit, Special Resource Center, IMR, will be the moderator for today's session. Ladies and gentlemen, in IMR, the veterinary officer function was to serve the researchers in projects involving animals. Since my posting in IMR from 2013, I have been serving many researchers and collaborates in several projects that use laboratory animals as their test system. This is why veterinarians are crucial in this institute. Ladies and gentlemen, this webinar series was initiated with the aim in mind to share knowledge, to discuss topics on biomedical research, and to present on some research outcomes. Before we get started, I would like to go over a few items so you know how to participate in today's webinar. Here are the housekeeping messages from the Secretariat. Number 1, we will not be taking questions during the presentation, but you will be able to submit your question to today's presenter using the link shared in the invitation email and YouTube chat box panel. We will collect the questions and address them at the end of presentations. Number 2, the question and answer session will be conducted at the end of second presentation. And number 3, the attendance link is also provided for those who would like to receive an e-certificate of attendance. You may find the link in the YouTube chat box panel. Ladies and gentlemen, for today's webinar, we have two speakers from Laboratory Animal Resource Unit, or in short, LARU. Our first speaker is Dr. Inirah binti Cik Ishak, who is the head of unit, cum veterinary officer in LARU. She was trained as a veterinarian from University Putra Malaysia and graduated in year 2005. She has been joining Institute for Medical Research since 2019. She is also a secretary of the Animal Care and Use Committee and has been advising many projects that requires usage of animals in their projects. She is a dedicated veterinarian that is passionate in her profession, plus she has a broad knowledge and experience in laboratory animals. For today, Dr. Inirah will be sharing her knowledge on today's theme in her presentation entitled Introduction of Anatomy and Blood Veins of Rodents, Rats, Mice, and Hamster. Dr. Inirah, the session is yours.
Okay, thank you, Dr. Azlina. Assalamualaikum and a very good morning, everyone. First of all, I would like to thank you for giving me this opportunity to share some information about the laboratory animal. It is an honor for me to deliver a presentation titled Introduction of Anatomy and Blood Veins of Rodent, Rat, Mice, and Hamster. This presentation is intended to expose researchers and the relevant personnel to basic introduction of anatomy and blood veins in rodent and appropriate methods used for blood sampling by using correct and effective techniques. Hopefully, this presentation will give you some idea about the proper sampling techniques you should plan before you start your research. Let's move to the next slide. Collection of blood from lab animal is necessary for scientific research, and there are several efficient methods available. As a researcher, they should have basic knowledge or information about the anatomy of blood vessel system. The blood collection procedure should be approved by Animal Care and Use Committee, Ministry of Health, ACUC, MOH, and they should provide details in the study protocol. This topic of presentation is important because as researchers, they are able to identify the sampling method to be used in their project. Sampling technique should be least painful and stressful to the animal because stress will affect the outcome of the study. This slide shows the basic anatomy of blood vessel system. As we all know, peripheral vascular system includes all blood vessels that exist outside the heart. Function of vessel is as a transport media to transport nutrient to organs or tissue, and also to transport waste away from organs and tissue in the blood. The peripheral vascular system consists of aorta and its branches, including the arteriole, the capillaries, the venules, and vein returning blood to the heart. As you can see here, this is the heart of the animal. The red line here refers to artery circulating system, while the blue line here referring to vein circulating system. This diagram shows the anatomy structure of the blood vessel. The blood vessels are made up by 3 layers. The inner layer, also known as tunica intima, the medial layer is tunica media, and the outer layer is tunica externa. Each layer of the system consists of specific cells. As you can see here, the tunica intima consists of endothelium because of loose connective tissue here, while the tunica media consists of smooth muscle and more elastic fiber. For the tunica externa, they have a collagen fibers here. This is how the structure of artery, veins, arteriole, and capillaries in our system. I mean in the body of the animal system. You don't worry, no need to memorize all the tissue I mentioned in this slide. Okay? So we go details for each blood vessel. Number 1 is the arteries. Arteries play a major role in nourishing organs with blood and nutrients. It is always under high pressure because abundance of elastic tissue and less smooth muscle. There are 2 types of artery. Number 1 is elastic arteries because this artery is nearest to the heart. Example, aorta and pulmonary arteries. The second one is muscular arteries. This artery is referred to the which muscle it used, the brachial artery, the radial artery, and the femoral artery. As you can see here, this is the structure of the artery. Okay, the artery is provide blood to the organs and it composed of smooth muscle. While the capillaries, in this capillary, the exchange of nutrients and metabolites occur primarily via diffusion due to its thin wall. This thin wall vessel composed of single endothelial layer, as you can see in this slide. Okay, the next one is venules. Smallest veins and receive blood from the capillaries. The exchange of oxygen and nutrient for water product occur in here. The venule is very thin wall and easily prone to rupture with accessories volume. And the last one is vein. The blood flows from venous into the largest vein. The venous pressure is low compared to the artery because of thin wall and are less elastic. There are several important veins that researchers should know. In general, blood sample is withdrawn from venous, arterial blood vessels or heart chamber. The common blood collection sites as stated in this slide. As you can see here, we have submandibular vein, jugular vein, the cephalic vein, the cardiac puncture direct to the heart, the siphonous vein, retroorbital sinus at the eye, the cranial vein, and also the tail vein. As I mentioned earlier, the red color is referring to artery and the blue color is referring to vein. Researchers should choose a right site or routes that fit for their study purpose and ones which cause minimal stress to the animal. Note that samples taken from different sites may have difference in biochemical, hematological value, and so the same vessel should be used if samples are collected throughout a study. This table shows a summary of common blood collection in rat, mice, and hamster. Competence in animal handling and restraint is essential before you do the sampling. Personnel must be able to handle and restrain the animal. Blood sampling in rodents can be done either under anesthesia or restraint. It is depending on the area from which the blood is taken. But why? Why we need to anesthetize or restrain the animal? This is because to make sure the procedure is easy, comfortable for both animal and researchers or handlers. Okay, for the anesthetic drug, we can divide into 3 categories. One is inhalant anesthetic, injectable anesthetic, and local anesthetic. Example for inhalant anesthetic is isoflurane. For the injectable one, commonly we use in our lab is ketamine and xylazine. And for the local anesthetic is lidocaine. Bear in mind, the use of this drug must be authorized and supervised by the veterinarian officer. Okay. As I mentioned earlier, sampling can be done either under anesthesia or without anesthesia. So if you are not using drug, you can use restrainer or handling tunnel. And also you can use manual restraint using towel wrap. Normally, in rat, we use towel wrap because of the size of the rat, bigger than mice. While in mice, we use the restrainer or tunnel apparatus. Ladies and gentlemen, this is some example of the sampling method that we use under general anesthesia. For the retroorbital sinus, this is how we handle or we hold the animal after the anesthetize. I won't detail up the procedure method. Perhaps we can have another session for each procedure. Okay, the number 2 is the cardiac puncture, where you can take either dorsal recumbency or right lateral recumbency. Other than that, sampling method through jugular vein also can be done under anesthesia, and the cranial vena cava sampling method. If you are not using anesthetic drug, you can restrain the animal, but they are not only using towel wrap, we can use apparatus like a tunnel. So this is example for saphenous vein, laterally and also medial side. And the cipulate vein, how we handle or how we hold the animal is like this. Okay. And this is also example for blood sampling procedure without anesthesia. The tail vein, sampling taken from the tail, and the tail prick. Okay, in general, the acceptable quantity and frequency of blood sampling is determined by circulating blood volume and the RBC turnover rate. Excessive blood collection may result in hypovolemic shock, physiological stress, or even death. I show you here the volume and frequency of blood required for each project. If you're willing to have single blood collection, you have to take 10% of total blood volume from a normal, healthy animal on an adequate plan of nutrient with minimal adverse effect. Sampling should be done once every 2 weeks for the single blood collection. Okay. For the multiple blood collection, recommended is 15% of the total blood volume. It can be done over 2 weeks period. Bear in mind, you have to double fluid replacement to this animal. You can use isotonic fluid. For the exsanguination is a terminal blood collection, where in this procedure, you can take a lot of blood from the animal, or we can say that you can bleed until death. Normally, we use cardiac puncture procedure. And this animal must be anesthetized and euthanized after sampling. This is how you calculate the blood volume. Okay, theoretically, total circulating blood volume estimate 5.5 to 7%, approximately 66 milliliter per kilogram of body weight. And it may be lower in obese and older animal, less than 15%. So, how to calculate the blood volume? The total blood volumes equal to animal weight in gram times to 0.06, the approximate circulating blood volume, and 10% of maximum allowable sample equals to total blood volume times to 0.1. This is an example. Let's say your animal weight is 300 gram. So 300 times 0.06 equal to 18 milliliter. But you have only to take 10% of maximum volume. 18 milliliter times 0.1 is equal to 1.5 milliliter. Alright, so to sum up my presentation, there are several factors determining the appropriate blood collection volume and techniques. Number 1, the species and size of the animal. Number 2, the health status of the animal to be sampled. You have to monitor the health status of the animal before sampling. Number 3, the volume and frequency of blood required. This one is very important because you have to calculate correctly. Number 4, the training and experience of the personnel performing the collection. And finally, the suitability of restraint or anesthesia to be used. Therefore, researchers, personnel or handler should plan ahead to ensure correct method chosen with sufficient blood sampling taken. And the most important thing is to ensure the animal is not suffering from any complication. By that, ladies and gentlemen, that is all about my presentation. Thank you for your attention. Back to you, Dr. Azlina.
Yeah, thank you, Dr. Inirah, for the enlightening presentation. To all viewers, if you have any question that you would like to ask about her presentation, kindly submit your question using the link provided in the YouTube channel chat box panel. Next, I would like to introduce to you our second speaker for today, Dr. Siti Zubaidah Chetlim. Dr. Siti Zubaidah is also a veterinary officer from Laboratory Animal Resource Unit, IMR. She holds a diploma in animal health and production in year 2006 and further her studies in the same university at University Putra Malaysia in degree of veterinary medicine. She graduated in year 2011. She is one of the Animal Care and Use Committee member and she involved in many lab animal projects such as good laboratory practice, monograph and non-GLP animal research. She is interested in laboratory animal works, animal breeding and health monitoring of lab animals. Today, Dr. Siti Zubaidah will share her presentation entitled Necropsy Procedure in Rodents. Over to you, Dr. Zubaidah. The screen is yours.
Thank you, Chairperson, for the kind introduction. Bismillahirrahmanirrahim. Assalamualaikum and very good morning to all of you. I'm Dr. Zubaidah. We share on necropsy procedure in rodent. Alright, this is my overview of my presentation today. I will start with a bit of introduction and proceed with necropsy protocol before necropsy, during necropsy and after necropsy. And I will end with a bit of conclusion. Alright, what is necropsy and why we do necropsy? Necropsy is a post-mortem procedure that consists of observation of microscopic changes of tissue and organ in situ with naked eye. It also considers as an important step in biomedical research using laboratory animal, in particularly in toxicity study, where histopathology is a major endpoint. And why we do necropsy? With necropsy, it allows us to detect, to describe, and a report of any gross finding that could be key to understand changes during in vivo part of the experiment. Other than that, to collect organ and tissue sample for further analysis. Alright, for necropsy protocol, we can divide into before necropsy, during necropsy, and after necropsy. But before that, necropsy personnel strongly recommended to read the experimental protocol carefully. This is because the list of organ that should be examined and sampled may be different from one study to another, it depending on the aim of the study and the duration of the study itself. Then we start with the preparation of the equipment and material, such as a fume hood, proper personal protective equipment, such as glove, mask, eyeglass. And then we prepare the dissecting board, the scissors, scalpel, forceps, and container for histology specimen. When all the material is ready, then we proceed with the animal. We start with examination of the live animal. We observe the behavior of the animal, the fur, the skin, to detect any changes. And then we proceed with external examination of the animal. We assess the general condition of the animal. Either the animal is emaciated or good condition or obese. And then we examine the eye, the mouth, the teeth, the nasal opening or anogenital to look for sign of diarrhea or rectal or vaginal prolapse. Then we proceed with euthanasia. Actually, there are various methods of euthanasia in rodent. The most important thing, the selected method should induce death quickly with minimal animal pain or distress and not interfere with gross observation and microscopic evaluation of the tissue. In toxicology studies, exposed to CO2 is very common use. Alright, then we proceed with during necropsy. We start with incision of the skin and examination of the subcutaneous tissue and organ. We proceed with opening of the abdomen and examination of the abdominal organ. And we open the thoracic cavity and we examine of the thoracic organ. And after necropsy, we do sample collection and preservation. During necropsy, it's critical for necropsy personnel to correctly use the term that define the orientation of the organ and section. For example, this is dorsal. Dorsal refers to the back of the animal, whereas ventral is referred to the abdomen. Cranial is referred to the skull, where caudal is referred to the tail. Lateral is pertain to a side, medial is closer to the body midline. Alright? Okay, there are few major of section that always being used. For example, medial plane, also known as midline. It is the plane that divide the body into equal half, left and right. This is sagittal plane. It is the plane that divide the body into unequal right and left. Alright? Okay, this is transverse plane. Transverse plane also known as horizontal or cross-sectional. It is the plane that divide the body into cranial and caudal part. And last but not least is frontal plane. Frontal plane is the plane that divide the body into dorsal and ventral. And then we proceed with examination of the subcutaneous tissue. We position the rat. We pin the animal on the dissecting board, ventral side up, and then we moisten the skin with alcohol, and we start with incision of the skin on the midline to expose the subcutaneous, and then we reflect the skin on both sides, and then we start examine the skin and subcutaneous tissue, and then we record any lesion that could be found. Alright. In female, the mammary tissue extends from salivary gland to the base of the tail. When lactating, the mammary gland occupy almost all the abdominal and thoracic ventral subcutaneous area. We harvest the mammary gland from inguinal region where the mammary tissue is prominent. Actually, there is a different numbers of pair of mammary gland in rodent species. For example, mouse have 5 pair, rats has 6 pair, hamster has 6 to 7 pairs. Alright, we continue with examination of the lymph node. Examine the superficial lymph nodes. Under normal condition, lymph nodes are grayish organ, bilateral, and have the size of shape of small piece. These are the most common superficial lymph nodes that we can examine, such as mandibular, axillary, branchial, inguinal, and popliteal. Other than that, known as deep lymph nodes. Okay, for example, this is the picture shown, this is the lymph node, mandibular lymph node, and this is the extraorbital lacrimal gland, and this is the salivary gland. You can see here. Alright, we proceed with examination of the abdominal organ. First of all, we grab the abdominal wall with forceps, and then we make a small incision. We cut the abdominal wall, we reflex the abdominal, and we start examining the peritoneum and look for the presence of abdominal content such as serous, fluid or blood. And then we check the position of the different organ in situ. You can see here, this is the thoracic cavity, this is the abdominal cavity. Alright, for spleen, spleen situated on the left superior abdominal quadrant here. To remove it, just grab and cut the connective tissue and fat surrounding. We examine it. It is a latent, oval, slightly curved shape, dark red color, soft consistency with transparent capsule. Actually, the entire spleen can be sampled and immersed in fixative. We continue with pancreas. This is pancreas. Pancreas is very diffuse and completely enclosed in the mesentery. It tan in color, easily identified from surrounding fat. Lift up the pancreas that attached to the spleen by cutting it with scissor, and then we take some part of the pancreas and we immerse in the fixative. Alright, for the digestive tract consists of esophagus, stomach, small intestine, large intestine, and mesenteric lymph node. You can see here, this is the esophagus, the stomach, the small intestine, and the large intestine. The stomach has two distinct regions, proventricular in anterior region, it whitish in color, and then this is the glandular region, redder and thicker. Both are clearly demarcated. Then we isolate the stomach from esophagus, and then we open the stomach, and then we immerse in the fixative. For small intestine, it has three different regions: duodenum, jejunum, and ileum. Duodenum is about 1 cm in rodent, and then jejunum and ileum are not recognizable grossly. The large intestine consists of cecum, colon, and rectum. Lymphoid tissue associated with small intestine, also called as a gut-associated lymphoid tissue or Peyer's patches. It appears as slightly elevated in the intestine wall and can be visible as prominent area when activated. We separate carefully the intestine from mesentery during necropsy, and then we do examination of the intestine. The examination should comprise at least the content, the thickness of the wall, the color aspect of the mucosa, or any noticeable lesion in each intestinal segment. Routine intestine sample for histology usually consists of, we make a one transverse section around 2 to 3 millimeter thickness from each part of the segment without opening it, and then we immerse in the fixative. Alright. Okay, this is the liver. The liver has 4 lobes in red, yeah, known as medial lobe, right lateral lobe, caudal lobe, and plus papillary process. There is no gallbladder in rat, but present in mice. It dark reddish with friable consistency. A thin transparent capsule covers the liver. A liver is a fragile organ that should be handled with caution. Alright, you can see here, this is the liver. Alright, this is the adrenal gland, and this is the kidney. Adrenal gland and kidney are located deep in the retroperitoneal space. These glands are small white structure within the perirenal fat. In female, adrenal gland tend to be large compared to the female. This is due to high lipid content in the male. Alright, this is the kidney. Kidney are located on dorsal wall of the abdominal cavity. Bean-shaped pair organ, brownish, red, firm. Right kidney more cranially surrounded by capsule. And then we continue with examination of reproductive organ. Reproductive organ in male, this is in male, consists of penis, testes, epididymis, and accessories gland, such as seminal vesicle, coagulating gland, and prostate gland. This is the testis, yeah. We can extract the testis by cutting the fibrous ligament that anchoring the tail of the epididymis to the scrotum, and then we examine the testis. Testis is the oval-shaped pair organ and a few millimeter in diameter that lay inside the scrotum. And then we can proceed. We remove the accessory gland. We check any signs of color changes or presence of nodular masses. This in female, yeah. In female, it consists of vagina, uterus, and ovary. We dissect the vulva and vagina free from the skin, and we cut the ligament of the vagina, uterus, and oviduct. We isolate the whole genital tract. We examine it. We examine the ovary and oviduct. Ovary are small, oval, reddish within the fat tissue, caudally to the kidney. And then we check the shape, the volume, the consistency, and the presence of any gross lesion. And then we proceed with examination of the urinary bladder. Urinary bladder can be fed of urine after we do incision of the wall, and then we sample as a whole in visitive. Alright, now we proceed with opening of the thoracic cavity by first we lifting the sternal xiphoid process with forceps, and then we cut the sternum, we cut the rib cage, and then we expose the thoracic cavity. Thoracic organ consists of tongue, larynx, trachea, thymus, lung, and heart, and also thyroid gland with parathyroid. What we do, we cut the muscle of the lower jaw with scalpel, and then we cut the soft palate and the pharynx, and then we grab the tip of the tongue with forceps and retract it gently to remove it from thoracic cavity. We isolate the heart from the lung by cutting the main vessel with scissors, and then we examine the thymus, we examine the tongue and the thyroid gland. Thyroid gland has two symmetrical oval shape, tan yellowish in color. The parathyroid are located around it or within the thyroid but are not visible grossly. And then we proceed, we examine the lung. Lung in rodent has 3 right lobe, which is a right cranial lobe, right middle lobe, and right caudal lobe. And then an accessories lobe and 1 left lobe. The lung parenchyma are normally a smooth surface, nice light pink color, and spongy consistency. For optimal microscopic evaluation, installation of the lung by physiative is strongly recommended. Alright, after necropsy, what we do sample collection and preservation. Make sure all sample for histology specimen are in correct container with physiative. Usually we use 10% neutered buffered formalin. And then for bacteriology, virology, mycology, parasitology, chemistry, we can put in the sample in specific container or ziplock, but make sure we label it or the organ correctly. For liquid sample, we can put it in tube, and then we discard and dispose carcass in biohazard plastic bag. So as a conclusion, necropsy is a major step for most study using laboratory animal, and it's very important step in biomedical research using lab animal where histopathology is a major endpoint. Then, since necropsy can be performed only once, it is crucial to follow a precise procedure that allow identification of gross abnormality and adequate sampling of organ can be done. Okay, that's all from me. Back to you, Dr. Azlina.
Yeah, thank you, Dr. Zubaidah, for the insightful presentation. We will now be moving to question and answer session. So please do not hesitate to send us your question, and I will try my best to connect you to our distinguished speakers through the posted questions. However, should the time does not allow us to address the question, Our speakers will try their best to answer the posted questions through email. So, ladies and gentlemen, in the meantime, let me share to you about our unit, Laboratory Animal Resource Unit, or in short, we call LARU. LARU serves IMR and the Ministry of Health in many aspects. For your information, our unit is located in Jalan Pahang, Kuala Lumpur. LARU have a variety of officers and support staff that functions from animal works, training of researchers, as well as university students. In IMR, we are very important as we are the main unit with breeding facility of lab animals to be supplied for the use of researchers, not only in IMR, but schools and universities. LARU is also important to serve the ministry following the requirements of animal welfare, where we serve the Ministry of Health researchers and advise them as Animal Care and Use Committee. Since LARU has 3 veterinary officers serving the whole IMR, it is important for us to get involved in any animal projects, especially the lab animals. As vet officers in IMR, we give trainings to researchers on many techniques that is required to use in lab animals. These include from the very basic techniques, which are the handling and approach of lab animals, blood withdrawal techniques, necropsy techniques, and also surgery method required. These trainings are given either in planned program internal trainings as well as one-on-one trainings whenever required by researchers. Many students from university and many new researchers in IMR has been trained by LARU vet officer. In LARU, we also provide facility and help maintain the research project, especially involving the animals. Our unit is the backbone of all research projects that runs in our facility. This is because we provide services such as preparation of feed and bedding, cage washing and sterilizing of the equipments for use of researchers. Okay, so for any inquiries from the audience, you can contact us by email as in the slide provided. It seems that we have a few questions from the audience. Okay, let us proceed to question number 1. Okay, bear with me. Okay, so question number 1 is goes to Dr. Siti. So, what is the correct procedure for a cardiac puncture? Can we open the animal during anesthesia until we can see the heart and collect the blood directly from the heart? So, the questions from Saida. Maybe Dr. Siti can explain.
Alright, the question is, what is the correct procedure for cardiac puncture? The correct procedure is what we are normally use in our lab is the animal is under anesthesia, and then when there is a animal ready, full anesthesia, then we can proceed with cardiac puncture. And the question, can we open the animal during anesthesia? Yes, we can open up during anesthesia and collect the blood directly from the heart. But this is the terminal procedure that the animal must be dead at the end of the procedure.
Yes.
All right.
Yes, thank you, Dr. Zubaidah. Yes, the main correct procedure. I mean the aim is you must puncture the heart. You check for the pulse rate of the animal. Where the pulsation is very strong, that is the best point that you can poke to do the cardiac puncture. Okay. It seems that we have another question for Dr. Inirah. So, question reads, what is your advice on how to handle fractious animal and how to approach them appropriately? Okay, Dr. Inirah.
Okay, thank you, Dr. Azlina. Okay, how to handle fractious animal? Actually, handlers should have basic knowledge of animal handling. So, they know how to hold the animal properly. If you cannot hold the animal properly with bare hand, you can use restrainer. As I mentioned in my slide previously, you can use restrainer or turner, or finally you can use anesthesia drug. But bear in mind, the usage of anesthesia drug must be supervised and advised by the veterinarian. Okay, Dr. Zina?
Oh, okay. Thank you, Dr. Inirah. Very clear explanation from you. Okay, next one. We proceed. It seems that another question here. So the question is for Dr. Zubaidah. In necropsy or postmortem of animal, what is your opinion regarding disposal of animal carcass and how do we handle them properly? Dr. Zubaidah?
All right, thank you, Dr. Zina. The question again, how? Sorry, where is the question just now? Okay. What is your opinion regarding disposal of
Yes.
animal carcass? Yes, for disposal animal carcass is very crucial. We have to dispose properly because we don't want it to be a source of contamination. And how we handle it? For in our lab, we just make sure the necropsy personnel or the one that handle the animals, the carcass, must wear proper PPE and not handle with a bare hand. And then we can put the carcass in the plastic bag, the biohazard plastic bag. We tie properly and then we put in the bin, the apa ni, yellow bin.
Yeah.
All right.
Yes. Thank you, Dr. Zubaidah. That is very clear explanation. Because we don't want the carcass to be the source of contamination to the environment, right? Okay. It seems we have another question here. The question is for Dr. Siti, Dr. Siti Zubaidah. So, how do we perform necropsy on the suspected infected animals?
How?
Question from Dr. Zawani.
How to perform necropsy on the suspected infected animal?
Yes.
Okay. First of all, when we suspect the animal is a infected animal, we have to do it in the biohazard or fume hood, and it's just like a normal. We have to wear proper PPE, but we do it in the fume hood, biohazard. That's all.
Okay. Thank you, Dr. Zubaidah. That is very clear. Hold on, audience. I'm collecting the question. Okay. We have another question here. Okay, question is for Dr. Inirah. So, let's say a school teacher or lab assistant or UC students required to have training in animal handling. How can LARU help?
Okay, thank you, Azrina. Actually, as Dr. Azrina mentioned previously, one of our function in IMR is to provide and conduct training for IMR researcher. But however, this training is not only focused for IMR itself. We open for outsiders out there who are interested to have training. You can come to our unit. You just make a formal letter, write to director of IMR, ask for the training, and we will conduct the training for you. So please come to our unit. Thank you.
Oh, thank you. Thank you, Dr. Inirah. Yes, everyone, please, you are welcome to our unit. Okay. It seems we have another question here. This is for Dr. Inirah. Okay. So, could you please share the anesthesia procedure for the mice and what drug use and the amount?
Okay.
You can share.
Okay, thank you, Dr. Azrina.
Yes.
Anesthesia procedure actually they can be done with two category of drug. Either you use isoflurans, inhalant of isoflurans, or you can use injectable anesthetic drug, ketamine, combination of ketamine xylazine. For the isofluran, we use isofluran levels of 1.5 to 2% at the flow rate of 0.4 to 0.6 liter per minute.
Yeah.
Okay, for the combination of ketamine xylazine, in our experience, what we use in our lab is, for ketamine, we use 40 to 75 milligram per kilogram, combination with xylazine, 5 to 12 milligram per kilogram. These both drug inject either intramuscularly or intraperitoneum. Okay.
Oh, okay. Thank you, Dr. Inirah. That is very clear. Okay, so we move on to the next question. Okay. Okay, so the question. Okay. Hold on. Audience, please bear with me. I'm looking for the question. Okay. Okay. This one is for Dr. Zubaidah. Is there any alternative way for blood sample collection if the cardiac puncture is not success?
Yeah, actually we do experience during necropsy, try to do a blood sampling through cardiac puncture, but it's not successful. So what we do, we proceed with abdominal. We open the abdominal. We collect the blood from abdominal aorta.
Oh, I see.
Alright.
Yeah, we have, yes, because animals, they have the blood vessel, like Dr. Inirah explained just now, very massive branches, right?
Yep.
Yeah. Okay, so this one is, okay. Okay, the question for Dr. Inirah, okay. Veterinary, okay. Is IMR, is LARU have provide course for dissecting rodents for the purpose of leptospirosis detection? Do we have this?
Okay, actually, if you want to proceed for the dissection or postmortem or necropsy of the animal, especially infected with the leptospirosis, what we need is the proper equipment, such as the biosafety cabinet, because of this leptospirosis is the zoonotic disease. So you cannot do in open table or open space in the room. What we do is in the biosafety cabinet, with the proper PPE for the handler, and the sample must be sealed properly and labeled properly. If not, you will what we say that, because this is the zoonotic disease, you cannot take it easy, do it simply. So you have to do in a proper precaution. So yes, IMR, we have do the dissection for leptospirosis animal.
Oh.
Okay.
Yes, it's okay. Thank you, Dr. Inirah. So another one, questions for Dr. Zubaidah. Do your facility have sterile cage with HEPA filter? Questions from Mr. Azman.
Yeah, we do have sterile cage and with HEPA filter in our facilities.
Yes. Yes, because our facility have the individual ventilated cages,
IVC.
right?
Yep.
Doctor? Okay. So, okay, audience. So another question here. Okay, so another question goes for Dr. Siti Zubaidah. Okay, just now you shared to us the two main cavity approaches in the necropsy techniques. Okay, do we need to approach this cavity separately? So why is this so?
Yeah, because we don't want to contaminate, for example, from abdominal cavity to thoracic cavity organ. That's why we do it in a system by system.
Okay, so yes, because when we collect, we don't want the other sample to be contaminated, right? Okay. Okay, hold on, everyone. Okay. 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 I'm still, everyone just bear with me. I'm still collecting questions from the audience. Okay. Okay. I think that is all the questions that we have. Okay. Okay, thank you everyone. So I'm afraid that is all the time that we have for questions from the participants. Okay, any additional questions will be answered by the speakers through the email. Okay, we hope this webinar has shed light on some research work that we are conducting at our institute, IMR, okay, and would spark interest in research collaborations with others. Okay. Ladies and gentlemen, now we have come to the end of our webinar session. I would like to thank all participants for their support to make this session successful. You may subscribe to our National Institute of Health Malaysia YouTube channel and click for notifications whenever there is a new post. Please stay tuned on our updates for the next session of IMR-SEAMEO webinar series. We really hope you can join us at the next session. Until then, many thanks from all of us at IMR. Take care and stay safe.